Weeks of the governor calling for ramped up coronavirus testing all across the state. It is now happening. Western Mass News is getting answers on local testing sites where those who are sick can get a rapid COVID-19 test. Western Mass News reporter Audrey Russo joins us now live in Springfield with more. Audrey?
As of this Wednesday, there are now 5 ambulatory testing sites within the Bay State Health System in Western Massachusetts, and that's just within their healthcare system. When it comes to community health centers, however, the governor's office has announced that they're providing more testing for those community resource centers across the state, and he's even provided more testing for one here in Springfield. The governor's office announcing this week that expanded COVID-19 testing would be made available to 12 community health centers in eastern and central Massachusetts. When asked about Western Mass at Thursday's press conference, the Health and Human Services Secretary said they've provided more testing for a community health location in Springfield, too.
I think it's almost like quadruple the amount of testing available in Springfield. And Caring Group is a Western Mass Community Health Center, which is one of the health centers that we expanded testing.
Within the Bay State Health System, there are now 5 ambulatory locations in Western Mass, one in Greenfield, Westfield, and Ware, 2 in Springfield, one of which
it actually opened this past Wednesday.
Dr. Glenn Alley says the tests are done at no copay cost to the patient, but he says you can't just drive up and expect to be tested right away.
The testing is by appointment only at the testing sites. That's to ensure the safety of the individual.
Alley says the patient must first receive a testing order through their primary care physician and then get referred to a site. Alley says there's capacity to test 80 people a day at each site and says so far they haven't needed to raise that ceiling. And because they now no longer have to send the kits away to be evaluated,
the ordering clinician has access to the result generally within 24 hours, which is much better than it had been a couple of weeks ago.
Now, the test that Ali says they're using is the nasopharyngeal one. That's the one that goes very far up your nose. He says that their instruments have not yet been validated for the throat swab or for the more shallow nose swab. And again, important to note, if you show up without an appointment, you will be turned away and referred back to your primary care physician. Live in Springfield, Audrey Russo for Western Mass News.